Now we are live. Hey, everybody, ladies and gentlemen, boys and girls, welcome to the
Hi.
Friday Total Health Live. I'm Dr. Christopher
Hi.
Vogelmann of drvogelmann.com, and my very enthusiastic, stick-waving, sign-waving nutritionist to the stars, Monika Klein, is also with me.
And I'm applauding you all for being here today.
Applause.
Wasn't there something like this on Romper Room?
No, you need a mirror. You got to look. Yes, and I see Jill,
anyway,
Jan,
happy to be here. Thank you for being here. I see everyone. I see Christopher.
Bobby. I see you.
I see you. I don't want to be there.
I don't want to be there, but I see you. Hey, so we have a week full of madness as usual, but we're going to talk health, and which is one of your most important.
Rise above the madness. Rise above the madness.
I was going to wear my mask to show you that I'm trying to prevent the spread of computer viruses, but Monika wouldn't let me today.
No, I wouldn't, because that's not how it happens anyway.
I thought it did. Let's talk about the virus.
Yeah. So what's new in the world of everything this week?
Are you so over this? I don't know. There's pandemic fatigue or COVID fatigue.
Yes. People were saying I'm so over it in April, and now it's like, so I looked at Worldometer, which I don't look at very often. Now Texas is overtaking California with cases.
Because everything is bigger and better in Texas. I used to live there in Houston.
Well, whatever,
whatever.
So they want, go have at it, whatever. So, okay, but again, there's not a lot of there's a lot of recovery, and I know there's questionable how is it 100% recovery and how long is that going to take? But yeah, I think there's just a lot of madness going on.
Well, I think part of the challenge is just getting people to agree to practice good public health habits, and then you could this whole thing could actually be very much under control within 6 to 8 weeks. Everybody just did the same thing. So
I was listening to somebody that I follow on YouTube, and she had just moved from Greece to New Zealand, and she was explaining what happened when she arrived quarantine. It sounded near imprisonment. She was escorted to a hotel and pretty much locked down. They fed her, and it was really not something I want to see for the future. And it was very scary to hear what happened to her, even though she said it in very friendly and she was willing to do it and she was okay about it. And that's what I'm afraid of, like people being okay about these kinds of measures, these sort of draconian measures.
The question is, do you want to be participating in spreading an infection, or do you want to do your part in protecting society as a whole? That's the question.
Well, that's the question, and I think there is, I think we've talked about the hype. There's a lot of hype about the numbers, and it's all about the cases, but yet the death rate is still not coinciding with the cases. I mean, just for example,
not everybody who gets it dies. That's why I wouldn't.
Not everyone who gets it gets sick either. I mean, we have a population of very vulnerable people. Absolutely.
Well, at least 40%. I mean, you're going to look at a lot of this stuff in public health. It depends upon how you look upon the value of human life. And are you okay with 2 million people dying in a population of 320 million or not? And those are questions.
Nobody's afraid. Nobody's okay with anyone dying. People will die, though, whether it's from COVID or from what have you. But what sort of illness or accident might befall they might succumb to.
Fewer car accidents per capita now because fewer people are driving. So
that's true. Although I must say, at about 11 o'clock the other night, we heard screeching tires over and over again. And
Were you doing donuts in the street?
That's what they're called, right? Donuts.
Well,
So I
donuts are where you
opened
hang out.
my window upstairs here, and I saw these kids. There were three of them doing squealing these times in the church parking lot. If they would have
They're
lost
doing donuts.
control, if they would have lost control, they could have smashed right into my neighbors, and killed them. And killed themselves.
My question there, since they were in the church parking lot, is what would Jesus do?
Well, Jesus would not do that, and
Jesus would not do donuts.
Going on praying. Well, actually, after we called the sheriff, then, but the sheriff was on their way, and
they left.
Well, no, there was a whole thing. I left because I didn't care anymore at that point. But they handcuffed some kids, and
oh boy.
But yeah,
what a lively neighborhood.
This is a very peaceful neighborhood. Peaceful, right? But people just don't know what to do anymore. People are just so, hyped up with all this adrenaline. They don't know what to do, and there's a lot of media, filling our airwaves with all sorts of fear, and that's what I have to say about that.
Are you feeling hug deprived?
That's so interesting because I just wrote an article about that, and that's why I wanted to talk about it, because really, we are. I mean, we're missing. I can't hug people when they walk in the door anymore. Hug people when I can't even, hug people, anywhere.
You can't hug the postman anymore.
Not that I ever did.
Oh, okay.
Never did.
So how would you, if you're feeling hug deprived, then how are you going to increase your oxytocin?
Well, great question. Pets, of course, are a great option.
Pets. I don't want a pet. What if you don't want a pet?
If you don't want a pet, that's okay. We have other ideas.
Good.
Self-massaging, which is using either raw silk gloves you can get on Amazon, about $15, or dry brushing. It enhances the touch. It enhances, this. We have 5 senses, of course, and this is a sense that we're really missing out on right now. Touch. Tactile. The tactile touch. Yeah, the tactile sense. And certainly different fabrics, silks. I mean, silk pillowcases are wonderful, not only for the beauty and the richness and the feel of them, but also they're great for your hair. So
slide out of bed
brushing, bubble baths,
One problem with silk sheets, you slip out of bed easily.
Well, just pillowcases. You don't need the whole.
Oh, thank God.
Silk sheets. It's actually kind of cold in the winter, and we are getting a little bit colder here.
Yeah, it's 60 degrees here, and it's freaking freezing.
Yeah.
I have adapted too well to Southern California weather.
Well, it was really, really hot and then really cold, like that. And that's how the spring was. It was really cold and then it was really hot. There's nothing in between. We used to have spring and fall. We absolutely did. But no more.
No mas. Hey, so okay,
I wanted to say something more about COVID and testing. And we had an aide here who is a nursing student, and one of his fellow students was diagnosed as positive, and so all of the class had to get testing. And he had his testing done on Wednesday, and by Saturday, when he was supposed to come in, he didn't have his test results yet. I mean, he didn't have his test results. So, what we decided that he should do is go and get some rapid testing, which is supposed to be a 24-hour turnaround. And these are all nasal swabs. Yep. And so he was able to get it within a half an hour, actually, because he knew one of the nurses that was doing the testing in the I think it was an urgent care facility. But yeah, I mean, he went first to a library where they had free COVID testing, and then he went to an urgent care covered by his Kaiser insurance. But also we've got another Moorpark College here in this part of the world, and they do pretty quick results as well, like within 24 hours as well. So there are different rates of getting your test results. So, try and find places that that will do it pretty quickly. And he's had 4 tests in the last week.
Yeah. I have a friend who actually, his wife tested positive after a birthday party celebration.
Mm.
And the other 5 guests or 4 guests to the birthday party tested positive. He did not. But the problem with the testing he had, because he's out in the eastern part of the state here, is that the free tests were 10 days to get the results. It's still not rapid.
All of them. Not all of them. You have to
not
find
rapid and he didn't want to he had to keep spending $150 or $160 a pop for the rapid test.
That is crazy. That's crazy. In fact, the rapid test is covered by this particular person's Kaiser insurance, but he didn't go to the Kaiser facility. But that is crazy. There are lots of facilities like this one that I'm mentioning in Moore Park.
Free. They have it at the library. Our library doesn't have anything like that.
Yeah, they have it at the library. I think this is a larger community than where you are, so.
Yeah, we have 26,000 people total on a good day. Most of the time, maybe 25.
So there's more resources and more heavily populated areas, of course. And so he's had those tests. But the funny thing is he got his rapid test done. And then I asked him, has he had chicken pox? Because my husband had shingles. And this is something new. I discovered that people who are born after 1995 automatically get a vaccine, a chickenpox vaccine, or herpes zoster varicella vaccine, which I think is crazy because they have to keep getting them because they only last 10 years. So get the chicken pox. I don't know why they implemented that rule. Why do you think? Maybe it's because we always have to follow the money, don't we?
Well, yeah, part of it is the money. Part of it is the belief system amongst public health officials that vaccinations are the best way to control various types of infectious diseases. It's a philosophical and public health debate that's gone on for many, many years. I personally had the chicken pox when I was, I think,
I did too, and all of us did here.
Yeah.
All of the people here had it, so it was not an issue. But of course, he hadn't, so he couldn't come into work.
I like bagels and lox better than pox. That was my.
Well, I mean, it's easier to get it when you're a kid, I guess.
Yeah.
But
we all got it. I was just ran through the elementary school.
Yeah, I mean, anyway, so that's so get your and another thing about the shingles vaccine, that's also a vaccine, of course, and you can't get that until 2 months to a year later after you've had shingles.
Well, you wouldn't want to get in December because that would be shingle bells. No, anyway.
Yeah, whatever. Shingle bells.
Shingle bells. Shingle all the way. Shingles all the way.
But my husband's rash was like maybe an inch by an inch. So it was really minimal, thank God. And he didn't have any pain, thank God.
Yeah, I've had a lot of patients who've had the shingles, the zoster infection, typically jawline and around the ear. And interestingly enough, there are chiropractic techniques that could actually relieve and heal up the virus pretty darn fast. Like we're talking within about 7 to 10 days.
That's really great.
Yeah, those revolved around using acupressure actually and some instrumentation. It was one of the best things my dad ever did in practice was taking care of skin conditions, including shingles.
Interesting. Yeah, usually it affects the torso. So
yeah, you get the rib cage too. But we had a number of patients who had along the jawline.
Mm-hmm. Interesting. Huh.
That virus, it sits there forever, and every once in a while, it gets an opportunity to travel.
Stress.
It'll typically travel along like the facial and trigeminal nerve, but more typically, it'll travel around the torso, following the the intercostal nerves, the nerves
You know,
that are in the muscles between the ribs. So
it's so interesting. His was right above the hip bone, or right on the hip bone.
yeah,
You
they
know?
follow because you have
Yeah.
larger nerves
I guess
that follow the crest of the
Well,
hip.
it's not the sciatic nerve, but yeah. So
No,
anyway, there we have a run through of COVID testing, shingles, and chickenpox, just for anyone who's interested.
and don't forget shingle bells.
Well, we have to.
We don't. All right, so let me see. What else did
That
we?
is a good one, though.
Oh, we talking about rapid and regular testing, but
Jingle bells is a good one.
it is good. Rapid and regular. Oh, we got Q&A time.
Q&A time. I think we should get some applause for that. Q&A time. Thank you so much for your questions every week.
And thank you for providing some answers.
Yes.
Hey, so first
Thank
up,
you.
First up in our Q&A Hall of Fame is Sheila. Somebody wrote San Fran. It's got to be San Francisco because no one in San Francisco likes to hear it as San Fran. I do remember that. I was corrected more than once when I visited there.
Or Frisco.
Yeah, it's just they like
No,
the whole thing.
the whole thing. It's not like LA or
San Francisco.
yes.
Just like your Pope Francis. Hey, I wanted to start.
My Pope Francis.
Well, my Pope Francis and yours. It would be my mother's, although she did like the German Pope. That's a whole other story. I wanted to start a weight loss program, but with the holidays around the corner, this is
Bells.
This is a good time. Not shingle bells.
No, we don't want you to have shingle bells.
No shingle bells. Not all the way. So. Well, is it a good time to
the question is it a good time because of the holidays and everything?
Well, you're in a detox program, and
I am on a detox program, and I am actually in the midst of all these holidays. We have our anniversary tomorrow, 22 years, and then Thanksgiving, and I will be on this fantastic detox, and I am cooking up a storm of really, really healthy things. I made this. It was a what was it? It was a ginger roasted pumpkin dish with quinoa. It was delicious. And when I get off, when we finish today, I'm going to make roasted carrot and fennel soup, which is delicious. And then mung soup I made, which is basically a lentil soup that has a lot of Indian herbs in it. And it's very satisfying, and I feel good.
I feel good.
I feel good. Despite we did have a
what about losing weight for Sheila?
Yeah. So I was going to get to that. We would have a time change. So it was a perfect time to be sort of starting a program like this because people are usually tired that first week, and it's a great way to sort of slow down a little bit. And so when you do a detox or some sort of healthy eating program, or specifically for weight loss, you do want to slow down a little bit. My experience with my clients who have started around this time in previous years, it's actually been beneficial for them to start a program at this point, because when Thanksgiving happens, when you enter the Thanksgiving period, you have this kind of dietary regimen that it's already ingrained, so you know what you should be eating, and certainly you'll have that Thanksgiving meal for that meal, or maybe 2 meals, but usually for that meal, and then you're done, and then the next day you're back on track. And when you're especially when you're paying money to be in a weight loss program, you're much more committed. Yeah. Absolutely. And that does keep you in line and keep you straight and narrow. I mean, my donut aide brought in donuts, and I said, take them back.
Do not do that. Do not.
And he did it specifically to tempt me. And I'm like, if you've decided that this is something you want to do for health reasons, and weight loss will be usually for a health reason, you just have decided, and that's it. 100%, you're in. And of course, you might veer off a little bit, but you know what to do. You have a program that's sort of like your safety net.
Yeah, I think that's very significant. We used to call it doing a food experiment. So you have
Yeah,
the big
yeah,
Thanksgiving dinner, and we called it the pancreatic challenge when it came to the pumpkin pie and whipped cream. So,
and all the other stuff because
oh
it's
yeah,
not just that stuff.
mashed potatoes, and
And it's also the other sweets too. There's lots of other sweets.
I've never, quite frankly, understood the whole sweet potato or yams with marshmallow thing.
Me neither. Thank you. Me neither. It's a very American thing, I think.
I think it's very American. It's just very disgusting. But I mean, maybe some of you who are watching today or going to comment later on the replay will tell us if you like
Yeah.
yams with marshmallows on. Maybe it's just the marshmallow part that I really don't like.
Let's have a vote. Let's have a
Marshmallow,
marshmallow yam thing. Yes or
marshmallow
no?
yam, yes. Marshmallow yam, no.
So easy. We want to know. We want to
We
know.
want to know.
Yes
I'll even put the
or
question
no
below. We want to
on
know.
the yam, marshmallow, whatever dish, Thanksgiving dish.
We think the yam what am is okay as it am. But I mean, it's something about the marshmallow thing.
It's just so sweet. The yam in and of itself is so like not so sweet, but it's got a sweetness.
You know, in terms of sweetness and stuff, and I mentioned pumpkin pie a little while ago. So my wife Maggie just recently created something. It was a pumpkin tres leches. So it's a cake, and it's soaked with 3 different types of milk and things like that. It is so less sweet than any piece of pumpkin pie that I've ever had in my life, and it was so much so that one of our friends or one of our neighbors received some of it, and her husband, who doesn't like desserts, loved this dessert because he just.
So what made it less? Is there more milk in it? Is that what?
It's like there's condensed milk and 2 other milk type things. You know, there is sugar in it, but not a lot at all. And I think there's far less than there is in your average pumpkin pie. And so I thought and it was very light too. And so in terms of a dessert, one thing I have found is that tastes do vary because Americans have so much more sugar in their candies and in all their different desserts than Europeans do.
And salt. And
Mexicans too. Yeah, also Mexicans, their desserts are not very sweet. Not at all.
Yeah, a lot of traditional desserts aren't very sweet. But you know, I had this what it was called ginger roasted pumpkin quinoa salad. And I didn't have I do have a pumpkin, but I haven't cut it up yet. I used butternut squash instead, and it was sweet. That has sweetness too. So did the grain. So did the quinoa. Yeah. Most grains have a sweetness to them. So
hey, speaking of which, can you post that recipe in the Total Health Live group?
I'm not sure. I'll have to check with the creator of it.
If we give that
trademark, it might be, but I will post something.
I don't know that you can't trademark a recipe.
You can't?
No. But you could have a copyright on the images, but it's almost impossible to copyright a recipe. Take that from somebody who's married to a food blogger. So
okay, well there you go.
So I think you probably can post the recipe and just acknowledge where you found it. That's fine.
It's a comment on the I will post it. You bet.
Total Health Life group. Hey, by the way, so if you want to see that recipe and try that recipe out, you do have to request to join the Total Health Life group. So.
I do have a picture of it too.
Good. Let's do the picture.
Yeah.
Oh, what? But if it's your picture, it's okay. If it's somebody else's.
My picture of me eating it.
Well, there you go. And if you want to watch Monika eat, please join the Total Health Life group.
It's authentic.
It's authentic. All right. So, hey, speaking of authenticity, so we did discuss that, you can get on a program and just have I guess, you can think of Thanksgiving as a giant cheat day if you want to.
Well, yeah. And I don't like to frame it that way because cheat day? I mean, it's, what
do you want to call it? A food experiment?
Call it like Thanksgiving. It's just Thanksgiving. You're going to eat Thanksgiving types of foods.
Well, as long as you're not giving too much to your stomach, because your stomach may not be that thankful. So.
Well, here's the thing: when you're on a program, you are not eating as much because you're accustomed to eating a certain way, and you won't even feel good if you eat too much of this. And that's what I found when my clients would come back and report the next week and say, yeah, I had a little bit of this, a little bit of that, but I really, you're not craving things anymore because your body is aligning and getting more in balance.
Yeah,
So
not as much. In fact, gosh, you know what? I haven't had ice cream since March or April, I want to say.
no, it must have been in June because
June, maybe it was June. But I mean, I don't really miss it.
yeah, and that's what happens. You don't really miss
Like,
it.
I can't even remember the last time I had it.
I'm not having any coffee. And the first day I was amazed there was no headache, no caffeine withdrawal headache. But the next day I had a headache, but I think it was more structural from the back of my head rather than a detox headache. But you just replace and you get used to other things that are, beneficial for you.
Hey, speaking of getting used to things that are beneficial, Mandy. Oh, it's like very mental. Oh, Mandy, you
I
kept
have
me.
a niece named Mandy.
Mandy from West LA. That must be close to you.
Yes, it is.
Farther from me. She asks, my job is even more stressful now. I don't even know if she's commuting as much or if she's at home. But she says, my job is even more stressful now. What can I do to ensure that I maintain some of the good habits that I developed when COVID first started? What were those habits?
Yeah, I think a lot of people just sort of, oh, I have free time now. Oh, I have time for me now. Oh, and then it became more of a slog and a depressing kind of feeling, for whatever
So I
reason.
think, so you're saying that she's talking about self-care, maybe.
Well, what do you think she's talking about?
I'm trying to figure out, maybe she forgot to wash her groceries when she came home, or
Like more safety measures
more
than
safety measures. It's interesting. We both look at the same question, and I have it interpreted differently. But all I can tell you is that if you have more stress, one of the ways to overcome the stress is to get back, like JoJo in the Beatles, get back to where you once belonged.
Get back to where you once belong.
Yeah. I would say go back to practicing, always take a mask with you, do those types of things. But if, on the other hand, wash your groceries, that type of thing. But on the other hand, if it's that you were taking better care of yourself before in terms of maybe a relaxing bath or listening to good music, turning off the news, things like that, that would be a good habit to adapt again or restart.
Yeah, and it might be, she was exercising more.
That's true too.
Something about her job. She's working more. Is that what I heard?
It says working more, but I can't tell if she's working more from home or she has to commute and go in. It doesn't, you can always let us know.
Yeah, exactly. Well, I would just say that, definitely try and, incorporate just one of those things that you started before. These again, when COVID started, is like everyone, either was eating too much or not eating enough and exercising. So some people went one way and some people went the other way. And so if that's what you're talking about, then I would definitely, look at how good you felt. And another great thing is journal, food journal, feeling journal, all of those journals, because what happens when you're feeling discouraged or you're not in rhythm anymore, you can go back and read those to feel inspired again and look at oh, hey, I did this before. I can do it again. Like when I was thinking about doing this pretty intense detox for myself, which I used to do all the time before my husband got really sick. I used to do it. I'm very familiar with how to do it in all sorts of different ways to bring these healthy practices into my life. But when I saw this and I thought, oh, all this cooking, all this stuff, I have to give this up, I have to give that up, I thought, I can't do it. I just can't do it. And I you start thinking, you start imagining, what would it be like after this period? What would it be like on a day-to-day basis? And it's amazing how many things start clearing out of your life. They just disappear, or they're not important anymore. They don't become important anymore. So there's no mad rush to be healthy. It's a day-to-day thing, sometimes a minute by minute, hour by hour thing. Just do one thing at a time.
Yeah.
Pick one of those habits that you felt good about and start again.
True. Well, there may be no rush to get healthy, but Rick from Daytona Beach is asking, he says, I've always struggled with weight, but lately I'm feeling ready to make some big changes. It sounds like he wants to do something fast. What do you suggest I start first when it comes to my diet?
Well, kind of sort of what we were talking about already.
Water.
Or
water.
some healthy.
He says, what do you suggest first? He wants to make some big changes.
Yeah.
I think a big change is just if everybody drank at least 64 ounces of water a day, that would be a big change for the average American. So,
or taking a 20-minute walk a day, just
that'll do
going
it.
out. Just
Walk
going
with your water bottle.
Walk with your water bottle. A lot of the things we've talked about in previous weeks, it's just pick one. Unless you, of course, it's, as you said, maybe he wants to just jump into something and, all two legs or four legs, whatever.
4 legs. Poor guy.
Jump in with all his whole being. He wants to jump into something and do something, cold turkey. So if that's the case, then you want to find something that is doable. Maybe you need some help sticking to it. Maybe you need to work with somebody, because I tell you, it works so much better if you have someone to work with, someone to guide you, someone to be accountable to, someone to, share your, challenges and your wins with somebody.
It's true.
Yeah. And I tell you, if you put some money into it, it's often there's more commitment to.
Well, that you invest in yourself, and as a result, you pay more attention.
It is an investment in yourself, and you can either invest in a healthy eating program, or you can invest in medication and treatments in the future. I mean, that's the only other option really in your future. So,
I like to say sometimes that you're either are going to invest in taking good care of yourself, or you're going to divest yourself of health.
Yeah, absolutely. You're not going to have the health, and it's going to be a lot more expensive, lot more expensive down the road. Yeah. My husband's getting this breathing jacket. It's called a Smart Vest.
So like a thunder shirt for a dog?
They're for pulmonary, for helping to cough. It's actually a cough assisting device. And those are $16,000.
Oh.
Yeah. So take care of your health today, so you don't have to go down that road.
You don't have to buy a $16K breathing shirt.
Yeah, and not only the cost of it, but the cost to your well-being and
quality of life too.
Oh my goodness, yes.
Yeah, coughing can be very uncomfortable. I remember my dad had a triple bypass many years ago, and they gave him a pillow, a heart-shaped pillow that you had to push against your chest because they split open the sternum. And then so every time he coughed, he had to hug that cushion as an assist for breathing. But
yeah.
He did really well after that surgery. I was so surprised. How they say that triple bypass patients, heart surgery patients, are always super depressed. He really wasn't, which I was.
Well, your dad sounded like he was just so upbeat all the time.
Very upbeat.
Or the offspring.
Yeah, kind of. Yeah, but the apple didn't fall too far from Papa Tree.
Mini dad.
There's trees. Hey, I know a place that's full of trees. It's Utah. And Tina comes from Lehi, Utah. She says the time change. Oh, we talked about this earlier. The time change really did a number on me. I'm feeling so tired. I hope I get my rhythm back soon. Any suggestions about what I can do to jumpstart my day? Well, it's been more than a week. Or it's been about a week, right?
Well, when did we get this question? It was
during the question came in. It just shows that this is our question number 4. So maybe this was Monday or Tuesday, because I know that anytime we do a time change, for example, when we spring ahead and people lose an hour, the number of car accidents increases by 20% the following Monday. So that's a stat that goes back decades.
That's
heart attacks too Monday morning. So
I had my first car accident on the day after, like it was the fall. So I guess it was, you
fell back. You gained an hour.
Yeah, it was dark at 5:30, and that's what it was. It was traffic, dark, and it was someone who banged into me, and I of course banged into the one person in front of me. So that was my first car accident. Day after the first working day after the time change.
It sounds more like Bangers and Smash.
It was. It was
Okay.
full of banging and smashing.
Banging and smashing.
But fortunately, none of us were seriously injured, thank God.
Good.
But yes, this is a problem for most people. So you're going to go to bed earlier is what you're going to do. And that's the best. I think that's one of the best things you should do. And really, I mean, of course, if you're working a full-time job, you can't rest and take time off. But yeah, when you come home in the evening, just don't do much. Don't plan to do as much as you normally do. I know when I tell people that, take things off your plate, it's mind blowing. How can I possibly do that? It's just too much going on. But again, you'd be surprised how many things you don't have to do today.
Mañana.
Mañana. Yeah.
But she's asking, what can I do to jumpstart my day? Well, I think, just getting up and moving around a little bit helps to trying to get up at the same time every day, as opposed to having an irregular wake up time. That helps a lot.
Yeah. But also on the other end of it is getting to bed earlier so you can have more energy the next day. So you're not groggy. If you're going to bed the same time, it will be an hour later. So, if you're used to going to 11, it's actually 12. You're used to going to bed at 11, it's actually 12. So that's what you want to do. You want to go to bed, earlier, 10, like whenever, 10. Now I'm getting all okay, so I was going to bed much earlier this whole week. And I normally go to bed at a certain time, and I was going to bed at a good time, like a really good time.
For a good time, go to sleep early.
Good time, like 10 o'clock. It's unheard of, but it'll give you the energy. Sleep will give you the energy, and it will jumpstart you the next day. You don't need to rely on stimulants to keep you going.
There is a certain rhythm that your body will respond to, and people will tend to sleep more in the months where there's less daylight.
And this is a good thing to mention too. Yes. I mean, it is a kind of a hibernating, look at the bears. We're hibernating in the winter, it's slower pace. It's less out, less light, less sunlight. So yeah.
It's
vitamin S. Vitamin S.
It's getting dark.
Getting dark.
Let's see.
I was very Bostonian during the the World Series, and I was kept.
Why were you Bostonian? The Dodgers were playing Tampa Bay.
Out of the park. Hit it out of the park.
Oh my God. There was no green monster.
I'm very active. I love the Dodgers, so I'm glad they won.
Finally.
Dodgers.
They're one of the best teams Brooklyn has ever had.
You know what? You're going to get kicked out of Southern California.
Eventually. They didn't get me yet. Okay, so hey, here's another question we got now, which is Michael from Glens Falls, New York. Gosh, that's Glens Falls is up in my neck of the woods near Buffalo. Pretty good. It's in the Canandaigua Finger Lakes region. Yeah. He says, I decided to give up coffee and I struggled with a headache. You were just talking about this. And I struggled with a headache for days. I'm diabetic. Oh no. And after I decided to take caffeine out of my life, I read something about coffee actually being beneficial to diabetics. Is that really true? What's a guy to believe?
Well, I've heard reports that yes, it does help with diabetics, but I don't have all the research on that. But it seems to be changing all the time. Like one time it's good and then it's not so good. I saw some mushroom coffee that was being advertised being good for your immune health. Of course, mushrooms, good, different types of mushrooms like maitake and shiitake.
Not the magic ones, though. Not the magic ones.
They may be good for your immune system if they're de-stressing you, I suppose. But yeah, so you have a take on that?
Well, I think that in general, these are topics that come and go. I know that, for example, coffee consumption has been implicated in reducing your risk of having a stroke by somewhere between 10 to 15%. And so, so I'm kind of pro coffee when it comes to that finding. And
Yeah.
there's a lot of different substances that, if taken in large quantities, will have either, I mean, small quantities usually can have a beneficial effect, and large quantities can really screw things up.
Just as anything, just as
Every
anything.
report is different.
Yeah.
And I mean, you can even try to substitute things. If you took caffeine out of your life, maybe, I think a good transition, I've used this before, is I went from caffeinated coffee to caffeinated green tea, and then moved into decaffeinated green tea. And that for me was an easier transition than just going cold turkey on coffee. But I've done zero coffee for 5-6 weeks at a time. But I do love, I'm on the bean right now. So
You know, when I was drinking coffee a few short days ago,
years ago, we're back in the good old days.
back on Sunday,
Back on Sunday.
a few days ago, it was the half and half that I put in there that was just so creamy and comforting. But yeah, it's again what I mentioned before. It's making a decision and doing it, and see how you. I mean, I would do a little more research on the caffeine issue or the coffee drinking. There's also a genetic factor too. If you can do a genetic test to see how you tolerate caffeine. That's also an interesting marker to see if maybe caffeine isn't good for you anyway.
And also be careful of the sources where you're reading things. I know a lot of patients I've had in the past, they'll come to me with an article from WebMD, and that's not as reliable as, say, the Mayo Clinic or Cleveland Clinic or something else like that. And so studies are often promoted in Prevention Magazine and other popular periodicals, and they're really designed to sell more magazines or to get you to subscribe. So.
Oh, and you have to look at who the sponsor is too.
Who's the sponsor? Who's the source? Yeah, and is there a big old ad placed right in there?
But I don't think caffeine and coffee is it's bad for you. I don't think it's bad. Maybe bad for some people.
I think it's excessive. If caffeine is an issue that's keeping you awake and you find you sleep better if you don't drink it after noon or 2 p.m. or something, then it's worth considering.
Or if you have some gastritis or some stomach issues, you don't want to do that, or any kind of digestive issues with caffeine.
Yeah.
Or jitteriness. Yeah.
It's that tick.
Yeah.
Oh, wow, we got a lot of New Yorkers today. Teresa from Westchester, up near where the Clintons are living, says, ever since I finished menopause several years ago, I've been struggling with weight around my middle. That's hard to say. I've been struggling with weight around my middle. What can I do? I wonder if Teresa's gluten sensitive.
Well, that would have
nothing to do with the menopause.
Your diet.
Yeah.
Usually weight around the middle is stress related, cortisol related, one of the adrenal hormones. So yes, that's often a problem at this time of life. And so what you want to do is I'm just like a prophet when it comes to vitamin S, vitamin sleep. That is going to help you a lot. So if you can reduce your stress, enhance your sleep, those two things just right there would be really beneficial, and getting some exercise. So three small things, but they're
three small things,
big things, but they're doable, and you can just start picking one of them.
3 small things that deliver big results.
Amazing results. So,
hey, here's somebody.
So it's often, and I don't think you have to look at.
What?
Hold it, just one moment. Sorry. Teresa from Westchester, one more thing I wanted to say. I mean, we haven't talked about your diet at all, but certainly
contact Monika is what I say.
Yeah, a lot of sugar and
send her a message.
Yeah, contact me. Yeah.
That may be the fastest way.
Yeah.
And the only reason I was trying to get to the next question is because I have another broadcast at the top of the hour.
Well, let's do this, and we don't want to feel rushed for you. We're here for you.
Back in the Boo, the Boo. The Buddha,
I used to live in the Boo.
Like Richard Gere. Well, I don't know if Sherry knows Richard Gere or not, but Sherry from Malibu asks, what's the best way to control my portions? And to stop snacking. I know I need to, but it's hard for me. I think I have an addictive personality. Huh.
Well, that is a catchphrase that the addictive personality. We haven't live in an addictive society. Let's just put it out there, and
Like
that's
Netflix. That's addictive.
Netflix, anything. On your phone all the time, whatever. Drinking something, eating something. Compulsively, and so we do live in that kind of environment. So whether you have an addictive personality or not. That's we don't know. You might not. But
You could become addicted to exercise or something, which would be better than being addicted to surfing the TV on the couch.
yeah, you could be addicted to getting good night's sleep. You could be addicted to eating really healthy foods, fresh fruits and vegetables, and good grains. And
I think addiction really refers more to the excessive degree of some particular behavior.
addiction has a negative connotation, absolutely. So,
But you might as well face it. You're addicted to love.
well, snacking, you could drink more. Maybe it's oftentimes when you're like snacking, it could be a nervous twitch, or you feel kind of hungry, but really you're thirsty. So have some tea, have some, water, and that might quite. And if your hunger goes away, then it was clearly you were more thirsty. But usually snacking is not about hunger; it's about something else. It's about
Well, it can be. It could be actually about. I know that for many of my patients, as well as our teenager here, that often what people consider the sensation of hunger actually is a manifestation of thirst. And
that's
if you
what I'm
drink,
saying.
yeah, and if you drink water, same thing is true of tension headaches. That you give yourself water.
Dehydrated.
Usually 15, 20 minutes later, you'll find that the sensation of hunger is dissipated.
Yeah, so you can be dehydrated with the tension headache rather than it being an actual. It's just dehydration. Whereas, yes, it's often not hunger; it's thirst. So,
I want to show you one thing here. This came up with Tony Robbins' group back in April, and I just thought it was fascinating because I'm going to check this out here for just a second. Let me just show you this. In terms of portion control, this is a device that's coming up shortly. It hasn't been released yet, but it's called the Smart Plate. And actually, your food goes onto the plate, and it's associated with an app, and it actually will measure everything that's within this plate of yours, and you can actually adjust the portions according to what you're doing. I thought it was just very interesting, actually.
so it's just portion control and not
It's more than portion control. It will actually calculate everything. It has some AI in it, and it will actually, you could do keto or diabetes or low carb or stuff. It's a little crazy, actually. And it hasn't been released yet to the public, but I just thought it was just such a fascinating thing.
everything's smart now. Smart vest, smart.
Yeah,
plate.
you get the smartphones, you get the smart home,
Smart us.
you got the smart ass,
Smart us.
smart us. Okay, not the smart ass.
That's smart.
But
And
it was
smart all of you, everyone who's joining us. You're all smart to be here and take your health seriously
you're wicked smart.
and have
yeah.
fun too.
None of you is a pisser.
So yeah, that's kind of interesting. This
I thought it was very interesting. I think it's about $260 or something like that. We did not purchase it, but it was very interesting because apparently it's highly effective. Those people who have actually gotten the prototypes for it. But what are you going to pay $260 for every single person in your family to have a smart plate? Probably not.
You'll have to share.
$1,000. It could, for a family of 4, could be over $1,000 just for plates.
Yeah, just come and see me because I help the main person in the family, and then they teach. It's really you train your eyes, and there's certain foods that you just want to stay away from, and certain foods that you definitely want to have in your diet.
Train your eyes so you don't have
eyes, yeah. Do they zap you if it's too much or it's the wrong thing?
No, they don't zap you, but they do track everything on your smartphone. So basically, it is essentially a food journal that's recorded for you automatically. So in some ways, that could actually be an assistant to a nutritionist who's coaching somebody.
Yeah.
It's going to make it easier for the client to record.
What I like about actual journaling is you get to kind of like integrate the brain and the hand, and you can write other things, because it's not just about the food; it's about all these other things surrounding the food.
It's about
How
the
you're
emotions.
feeling,
The emotions.
descriptions of the food. It's a little more involved than just measuring, and
Well, yeah, but the emotional component of it is always the case for all the dieters I had in my weight loss
yeah.
center. It was all about the emotions and controlling the emotions so that you didn't slip into bad habits and you didn't slip into the addictive nature that you might be trying to fight. I mean, for some people, they really are addicted to sugar and they shouldn't be eating sugar. So,
Yep.
anyway, but what you should be eating, what you should not be eating, and things like that, eat this, not that. We'll see Monika next week when she's even more cleansed than ever before.
More cleansed.
She'll be totally
Happy
clean.
week, everyone. Please have a good one.
And reach out to Monika. You can private message her on Coaching for Health, the Facebook page itself, as well as subscribe to Monika's newsletter at coachingforhealth.com.
Yeah.
And we will be coming back next time. All right.
Yeah.
See you next week.
Great. Wonderful. See you next week. Have a great one.